Okay, we appear to have mostly leveled off with participants. So welcome to today's Physical Activity Alliance Professional Development webinar titled How I Use Physical Activity in Public Health. Thank you all for joining. My name is Alan Beck. I am the chair of the Professional Development section of the Physical Activity Alliance, and I have the pleasure of being the moderator of today's session. This webinar is being recorded and can be found later this week on the Physical Activity Alliance YouTube page, channel, and on the Physical Activity Alliance website, which is paamovewithus.org. During the presentations, please send any questions at any time during the presentation in the Q&A feature, and then we will collect these and address them during the Q&A sessions after every speaker, Today's speakers are Ann O'Connor, Deputy Director, Division of Nutrition, Physical Activity and Obesity at the National Center for Chronic Disease Prevention and Health Promotion, Centers for Disease Control and Prevention. And then Suzanne Kelley, the Healthy Communities Design and Healthy Food Access Public Health Programs Administrator from the state of Vermont. And finally, last but not least, Katrina Piercy, Commander of the U.S. Public Health Service, Acting Director, Division of Prevention Science, Office of Disease Prevention and Health Promotion, U.S. Department of Health and Human Services. I feel like I should take a drink after all of that. You all have very lengthy titles. So we'll go ahead and get started. Ann, you are up first. So we'll stop sharing this one and allow Ann to share her screen next.
Okay, great. And I'm going to talk a little bit before I share just a couple of slides. But let me just first thank the Physical Activity Alliance for sponsoring this webinar, and also for inviting me to participate as you heard, I'm from the Centers for Disease Control and Prevention. It's just truly a pleasure to be able to talk about physical activity, the importance of physical activity in public health, and really to share some sort of personal reflections on kind of the journey in terms of getting to how my journey to get to physical activity in public health and why that was important. And I'm also going to share some of the journeys of some of my colleagues from the Division of Nutrition, Physical Activity and Obesity as well. So it's a pleasure here. I guess the message I'd like to start with for all of you all is that really opportunities abound in the field of physical activity, public health physical activity. There's really great opportunities to really have a profound impact on getting the nation and getting individuals more active and healthier. And there's just a lot of different opportunities and ways to contribute in the field. So, and you know, that's sort of my main interest in public health work in general, and specific to physical activity, is really have the opportunity to make a difference. So, you know, the work that I do in the Division of Nutrition, Physical Activity and Obesity at CDC, I work with my colleagues across the division, and specifically in the Physical Activity and Health branch. And, you know, our focus is getting all Americans more physically active. And the good news is that we know as a public health community, there's a lot of science-based, evidence-based recommendations on how we can do that. And a lot of that is working with communities to improve how communities are designed such that people have the opportunity and access to safe physical activity spaces. And we do know that from the science. We know that if we build things like sidewalks and have proper lighting, and streets and communities are designed a certain way, we do know that people will be more physically active. And again, you know, physical activity, I think probably many of you know this, and other speakers may hit on this, but there's immediate benefits of physical activity in terms of how you feel right at that moment or when you're completed, but also there's a lot of long-term benefits to physical activity in reducing chronic disease for individuals. So really a lot of exciting work going on in the field in terms of working with communities on our evidence-based interventions. And there's also some exciting opportunities around surveillance and research around human movement data, and really trying to modernize how we measure and track physical activity. So that's been a major focus in my division and also of the agency. So that's just sort of stage setting a little bit to just talk a little bit and give you a broad brush of physical activity and public health. And I'm sure my colleagues, other speakers are going to touch on that as well. But what I was asked to share is I'm going to start with sort of my journey to physical activity and public health. And, you know, I just wanted to say that I'm probably a little bit of an anomaly, but I came to public health and probably like halfway through my professional career. I was and again, to give you some idea about the different, my journey and different types of ways that you can come to physical activity and public health, but I was a poli-sci undergraduate major, philosophy minor. And then my real interest was in improving government and making a difference in the world, not specific to physical activity, but I, from there, worked actually at the Department of Health and Human Services for about 15 years, trying to make programs more efficient and effective as part of the Inspector General's office, and really enjoyed that work and did do some work with public health. So along the way, I got actually a master's in public administration, not the traditional MPH, but again, I have found that been a really good skill set working at CDC and working in physical activity. I was fortunate enough to journey to CDC in 2006, working on emergency response and preparedness, and then doing some cross-cutting work for the agency around program development. But found myself in the Division of Nutrition, Physical Activity, and Obesity in 2013 as their deputy, and really became a big promoter and sort of cheerleader and supporter of physical activity, and really trying to spread and scale the important evidence-based strategies that we have to make a difference in the nation by supporting increased movement and supporting communities to facilitate that. So kind of all to say, you know, I've done a lot of different things in my career, but I'm really have found a great home working on physical activity. So I know many of you who are joining this seminar, I'm presuming, have an interest, and there's just a lot of different ways that can play out. I think the other thing for me is really the important part of the journey is sort of the power of prevention. And so I think it's one of the physical activity is one of the key risk factors that drive chronic disease, and that would include smoking and then poor nutrition. So it's a really important area. So at this point, I'm going to share my screen. The host has disabled participant screen sharing. Is there a way that you can release the screen? If not, I will keep talking. Okay, here we go. Thank you. Okay, so I wanted to, this is a screenshot of our physical activity and health bridge, and these are what I call some of our physical activity public health heroes, and they're here to greet you today on this webinar. And I wanted to share some of their comments, some of their journeys to work in physical activity. I will have to say most of them had a strong commitment to physical activity in their personal lives. We have one employee has a social work and public health degree. Her parents were in the medical field, and she really had a strong commitment to health and wellness. And after doing some work and research, she really realized the potential impact of public health and physical activity, public health work, and so joined our division to help make a difference. We have another, again, trying to show you some different pathways that people take to physical activity. We had another gentleman who's a Spanish undergraduate major and then pursued a PhD in physical activity and public health epidemiology, and working in exercise physiology, and did some work in the clinical sector, but really wanted to move to public health to make a bigger difference and bigger impact on the world as an epidemic intelligence service officer. And if you don't know about the EIS program, please do look that up. It's a phenomenal way to work in public health, and in this case, for this gentleman, physical activity. We have another employee who worked in kinesiology as an undergrad, and really wanted to, again, have a broader impact in the world. And finally, we had another employee who had an interest in mental health and how physical activity impacts mental health, and so really joined our branch and has that interest. So again, a lot of variety in terms of the backgrounds of folks. What I wanted to also share, let me see if I can, the next screen. Okay. What I wanted to just also say to you, and then I'm going to conclude shortly, is that there are a lot of different opportunities for working in physical activity, both at CDC, and I've just listed some of the topic areas here on this slide in terms of folks working at CDC on physical activity, which include the folks in my division, but also folks working on healthy aging, brain health, school health, injury prevention, health departments. We fund health departments to work on physical activity. Another major sector really is the transportation sector, both at the federal, state, and local level. That's where a lot of the resources come to make the community environment changes that we're recommending from a public health standpoint. Obviously, healthcare has a lot of opportunities, the education sector, and then also sports and fitness. So just to give you some ideas about sectors. And then I also wanted to just show you, these are some of the incredible partners that we work with, including the Physical Activity Alliance, to work on public health physical activity. So these are also opportunities to have an impact on physical activity. So I think with that, I am going to stop my presentation and see if there are, or I'll turn it over to Alan. I'm going to stop sharing. Hold on. Okay, now it's still sharing. Well, Alan, I'm having a little technology issue, so why don't you just go ahead and I'll figure out.
Yeah, as of right now, we don't. Go ahead.
Are you still seeing my screen?
Yep.
Oh. Okay.
There you go. You're good now.
I figured it out. Thank you.
Yeah, you're
Thank
good.
you.
As of right now, we don't have any questions, so we can go ahead and move to the next presentation. Suzanne, it's all yours.
All right, thank you. Hi, everybody. I am Suzanne Kelley, and now I am going to share my screen. I work at the Vermont Department of Health, and that was actually, try and get to slideshow mode here. Okay. Voila. Okay, does that look all right?
Yep, you're good.
Okay. So that was actually a really good overview, and I appreciate that because the order that we're talking here is you'll hear some similar themes in what I talk about, being a practitioner from a state who has had many of similar partnerships that Anne has talked about, and a similar journey to some of the people she highlighted who work in the division. So I will be talking about how I use physical activity in public health, but also talk about my journey to getting to where I am. So I actually, like Anne had mentioned, came to this work, believe it or not, I'm sure you will believe it, as a social worker. I got a master's degree in social work right out of college, and I was doing counseling with families and teenagers. After a few years of doing this work, it just didn't feel like a good fit for me. And I was thinking about, can I do something else? What else can I do? And something that I valued personally was being physically active and eating healthy, and felt like that had such a big impact on mental health as well as physical health. So I was thinking about, can I get into a career using the things that I'm personally interested in? While I was doing this counseling work, I ended up applying for and taking a position at the place I was working called Spectrum Youth and Family Services in Burlington, which is a drop-in center and shelter for homeless and runaway youth. And the position that I took there after doing counseling there was supervising peer outreach workers who were young people who would go out on the streets and talk to other young people who were homeless or running away about health behaviors and preventive type behaviors and risk reduction and connecting them to health services. And that was really what I feel like was a turning point for me, because it was my first glimpse into a career where you could do more work on prevention and physical health and sort of the things that I was really interested in and wanting to do more of. Believe it or not, at this time, I actually didn't even know what public health was. I didn't know about careers in public health. I didn't know about degrees in public health. I was trying to get into a physical activity, nutrition type career without going back to school, because I was kind of a young graduate with a master's degree already and trying to explore some different options. So while I was at Spectrum doing this job that I was really enjoying, as many of you will probably experience at some point or many points in your life, the funding for that particular project ended. I could have had another job with this agency, but it was doing work again that I really, it was a direction I didn't really want to go in. So I started to apply for some other jobs. I was so fortunate to have gotten a job at the Vermont Department of Health, starting in the tobacco control program, which is the 802 quits symbol right there, or logo right there, where that was really my first exposure to public health. And again, I really enjoyed it. I was working with community coalitions. I was doing work around tobacco prevention and cessation, public health messaging, enjoyed it, but it still wasn't quite where I wanted to be. So I ended up applying for and getting a job supervising the health department's You First program, which is the breast and cervical cancer screening program, but also had a heart health component to it. So that was really starting to get me toward where I wanted to be in terms of, physical activity, nutrition, that primary prevention type of work. That job was great. It was a great experience. It was very administrative. I was supervising a very big staff, and I felt very far removed from the fun work that I really wanted to do. So another job change landed me pretty much where I am today, with a lot of evolution within this position. I ended up, the health department got an obesity prevention grant from the CDC, and we were hiring a program coordinator as well as a physical activity coordinator and nutrition coordinator. And I applied for the physical activity position and I got that. So right now at the health department, I'm working in the Division of Health Promotion and Chronic Disease Prevention under the Physical Activity and Nutrition Program. And I oversee the Healthy Community Design Program and SNAP-Ed. SNAP-Ed, for those of you who don't know, is basically an obesity prevention program for people eligible for SNAP benefits, where we're basically promoting physical activity and healthy eating, doing nutrition education and policy systems and environmental changes, really specifically to people eligible for SNAP benefits. So the division that I work in, I appreciate that. I think Ann touched on this with physical activity and its role with chronic disease prevention. My division, Health Promotion, Disease Prevention, is organized around this slogan, where we talk about 3 behaviors: no physical activity, poor diet, and tobacco use lead to 4 diseases: cancer, heart disease and stroke, and type 2 diabetes and lung disease, that result in more than 50% of all deaths in Vermont. If you break that down by special populations, rural, BIPOC, people living with disabilities, that percent gets much higher. So a lot of our work obviously is really trying to focus on some special populations or more rural communities around the state and trying to reach people who struggle even more than the general population. So that said, I just wanted to give a few examples of the type of work I do. And again, just reiterating what Ann was talking about, in my job, I have had just this great opportunity to work with such diverse professionals who you never would think that you would work with, maybe doing physical activity promotion. So I work with planners, I work with engineers, I work with municipal leaders, community coalitions, just like a range of folks who I never even, again, thought I would ever be working with. So I do a lot of funding of projects. The health department gets, whenever we get any kind of funding, like block grant funding or CDC funding if we can, or all different opportunities, I'm always raising my hand saying, I can spend it, and trying to give some grants to community groups who are wanting to do things to improve access to physical activity. With an eye toward economic development in downtowns, driving the public to downtowns, using sidewalks, improving pedestrian crossings, improving trails, things like that. So fun bike racks in a little, very rural, small town in Vermont with benches. We did a benches and bike racks project during COVID. That's why those young people there are wearing masks, showing off the new bike racks. And benches, although it seems like benches don't help support physically active lifestyles, they actually are a really important street amenity for people who might have a disability, who might not be as physically active as probably a lot of people maybe on this call are, but want to go down to downtowns, want to be able to walk, but also need to know that there's a place that they can sit if they need to. It actually is an incentive to get people to downtowns and to be walking. Our goal in Vermont is to really focus on people who get no leisure time physical activity. In general, our physical activity rates are relatively high compared to maybe other parts in the nation, but the rates of people getting no physical activity are still concerning. So trying to find opportunities to get people active in any way that we can in their everyday lives. This is a little rail trail with a kind of an old train station stop that's used for just a welcome center that looked like this before. With some of our funding, we tried to beautify this a little bit and make it more inviting. So gave some funds for a bike repair little station. There's water station there. There's some new planters that the community has put in, as well as signage toward the town, which is maybe a mile up the road off this bike path. So trying to get people down to the downtown to buy a cup of coffee and look in the shops and help with the economic development in this tiny little town in northern Vermont. We do lots of funding of kiosks, wayfinding signs, trail improvements. And lately we've been doing some work around placemaking, where we're trying to encourage communities and support communities on doing things to really drive people to reactivate spaces that previously weren't used. This is downtown Rutland. It is a space that's used, but it's a busier street that we helped with parklets and narrowing a busy street. Again, that gets people to downtowns. It also starts to narrow streets so that people feel safer biking and walking on streets because traffic is slowed. So kind of like Anne was saying, you know, my path to this job was not exactly a straight one. And I had no idea I was going to end up where I am today. I love what I do. It's a really great fit for me. But it was definitely a series of different steps that I took from one career really to a whole different career over the past so many years, ending up in a place where I really feel good about what I'm doing and really feeling like I'm contributing to chronic disease prevention and beautifying Vermont's little downtowns and trails and parks and stuff like that. So it's quite a lovely, lovely place to be and really fun. And that's it.
Great. Thank you, Suzanne. I have a question for you.
All right.
Somebody said, I'm a physical activity educator at a Metro Health Department, and I'm currently trying to build an adolescent health initiative from the ground up. Are there any great examples of adolescent programs that you can think of in your state or nationally, or any tips?
Well, honestly, my mind goes to a few places. You know, first of all, most of my work is around this sort of built environment, policy systems, environmental changes. So anything that you can do, again, to make sort of physical activity the easy choice is a good way to go. So if there are ways to just make, I don't know if this is in an area where it's a matter of promoting things like kids walking or biking to school and doing some safety things around the schools, make sure that there are bike racks at the school that are covered if it's a place where it might have bad weather or raininess and stuff like that, and or safety issues. So the bike racks are out in front of the school, making sure that crosswalks are safe so people feel safe using crosswalks. Honestly, disincentivizing things like single car parents picking up kids like one after another, letting them go last after the walkers and bikers go first. So things like that just around the school are opportunities. I think one of the best resources I know of, honestly, for some evidence-based programs to find them, from direct education up to policy systems and environmental changes. There's the SNAP Ed program has a toolkit that's full of evidence-based strategies that you can search by age, population, PSE, policy systems, environmental change, direct education. And I can actually put a link to that in the chat as sort of like, that's usually my go-to place to find evidence-based strategies to begin with. And if I can't find anything there, I might then start asking colleagues and others around the state.
Thank you. I have a question myself, actually. So the story about the benches was intriguing to me.
Yeah.
I call it the seating paradox, where we found out the same thing, that people weren't using walking trails because there were no benches. We didn't really think about that. But how did you figure out that benches actually would promote physical activity? It seems paradoxical for sure.
Yeah, how did we figure that out? You know, I don't know how we figured that out. I think it's a combination of, again, you know, there's the Community Guide to Preventive Services that does talk about policy systems and environmental strategies and streetscape design. So if you're making downtowns appealing, a place where people want to go, whether that's through beautiful new signs, wayfinding signs, benches, lighting, the stuff that you don't think of as improve a sidewalk and people will walk on it. These other things have been really an important piece of getting people to downtowns. One of the really fun things for my job is that, you know, I get to work with lots of different professions, and one of them are people who care about revitalizing downtowns. So how I've always come to this work is that we all have different, maybe ultimate goals that we're shooting for, but to get to those goals, sometimes there are some similar, or we might have different reasons for doing what we're doing, but there's similar strategies that we can employ to all work together. So I think that, you know, it could have even been an economic development thing that people are saying we want benches downtown. And I was like, oh, that doesn't really support physical activity. But then just seeing that, you know, and hearing that it really is something that people want and it drives them downtown, and then they're using things like stores and restaurants and walking from place to place. It just sort of, I think, was really the result of partnerships. And again, I am sold on really focusing on people who struggle the most. So my audience is not me. My audience is somebody who might be very overweight, who's maybe like my dad, who recently needed a hip replacement, where I'm going to be someday, you know, that wants to still be physically active, but struggles. And so how can we incentivize that population? And if that population's incentivized, the rest of us will be too. So benches were one of those strategies.
Yeah, and somebody actually put in the chat, especially park benches can also be used exercise equipment. Somebody's been doing their program for 20 years and that's what they're seeing. So that's kind of interesting. Those are all the questions for you. So thank you, Suzanne. We will move on to Katrina. If you have any more questions for Suzanne or Ann, feel free to keep putting them in the chat and we can kind of do this around the back end if we need to. So Katrina, take it away.
Perfect. Good morning. And first, I just want to say thank you to the Physical Activity Alliance for inviting me to be a part of this panel today and share some of my background, how I got to where I am, and talk a little bit about some of the work that I'm doing now. So to give you kind of the starting point, for me, kind of the physical activity piece started really when I was a kid, but mainly as I got into college. I went to St. Joseph's University in Philadelphia on a soccer scholarship, knowing I wanted to do something in the health science related field, but not quite sure. I still remember the exact day when I stumbled upon the definition of an exercise physiologist. And I remember going to my advisor's office and saying, I found it, like, this is what I want to do. And he was like, I don't even know what this is. And I was like, I don't know either. But this description, and I'm not sure where I found it, but the description of the type of work an exercise physiologist did, the people that they work with, I was like, this fits. And he was like, well, I'm not sure how you're going to do that here, because it was a small Jesuit university. So essentially, I realized very quickly that I needed to go to grad school, but I built as much as I could within my undergraduate career to prepare me for the next phase of things. So I majored in interdisciplinary health services with a minor in biology and psychology, and then took courses over the summer to make sure I was on the right track and that I liked kind of this exercise physiology side of things. So I was taking some summer classes and also trying to prepare myself to get into a graduate program. And as I started researching programs, I realized, gosh, if I'm going to go study the exercise side of things, why don't I put together the nutrition piece? And being an athlete, that was an important part for my whole career of thinking about what am I eating and how am I timing things and performance. And so I was really looking for a graduate program where I could combine both in one department and work with humans. And at the time, there was not a whole lot of programs out there, but it led me to Virginia Tech down in Blacksburg, Virginia, where I started initially as a master's student coming right out of my bachelor's. Quickly learned that if I wanted to be a registered dietitian, I would need to take a giant list of requirements to be eligible to do a dietetic internship. And so they said, well, here's a master's, here's all the classes that you need to take, or you could fast track into the PhD program and we could fund you for 5 years and you could fit these courses in over a slightly extended time period. So I thought, I think I would like to teach. I worked actually as a health educator when I was an undergrad in college. That was one of my jobs that I stumbled upon a sign and I was like, health education, this sounds like fun. So I had kind of a background in some of this and kind of teaching some courses there, decided to get into the PhD program and essentially was funded for 5 years on a teaching assistantship. And so my position was actually within a cardiac rehab program, which was fascinating and challenging at the same time. Essentially, I was one of several grad students. We ran a cardiac rehab program within the university, but then I also led a course for senior students, applications in clinical exercise programs. And so it was a great experience for seniors to have hands-on experience with actual individuals that were coming through the cardiac rehab program. This was kind of phase 3 of the program. And so from there, I obtained all of the hours to sit for the ACSM exam to be a clinical exercise physiologist. So I thought, let me knock out that side, but still doing all of the courses on the nutrition side. And so I finished my PhD and said, okay, now I need to finish the nutrition piece. My background in research led me to the National Institutes of Health here in the DC area to do my dietetic internship because I really wanted that research component, and they have a tremendous internship program. And so essentially my life was planned through grad school, the internship, and everybody said, what's next? And I said, I don't know, but I need to figure out a way to combine physical activity and nutrition together. And there was a little bit of that at NIH, but we were in the clinical center working with a lot of patients that frankly, you couldn't even talk about physical activity. Many of them on different research studies were at such a point that your main concern was food and kind of how they were adapting to whatever treatment they may be on. And so there really wasn't the physical activity integration. So I dabbled in sports nutrition. I did some work with bariatric surgery patients and thinking about how to kind of connect some of these dots. And then I stumbled upon my position that I'm still in now at the Office of Disease Prevention and Health Promotion. And essentially reading the position description said, doing nutrition and physical activity policy. And I was like, well, I know nothing about the policy landscape, but I have a PhD in both of these. I have an exercise physiology credential. I'm a registered dietitian. Let's give this a whirl. And so I started in my office back in 2011 and have been here since, kind of growing into the position and adding more pieces. I also added on, as you can see, I'm here in uniform today. So in 2013, I joined the U.S. Public Health Service as a commissioned dietitian. And I'll give you just a snippet. I'm also happy to answer questions about the Public Health Service because many people may not be aware of them. And I actually was exposed to this group first when I was at NIH. So we are one of the larger branches of the military, but we're considered a uniform service. So we are unarmed. We're also called America's Public Health Responders. And so you probably heard a lot more about us over this past few years with everything with COVID. So the Public Health Service is made up of individuals that have a qualifying medical related degree. So as I said, I'm a registered dietitian. There are scientists, there are nurses, there are physicians, and collectively we work across the U.S. Department of Health and Human Services and in several other underserved populations. So there's officers in the Bureau of Prisons, in the Indian Health Services, basically across the United States and some individuals overseas as well. And we get deployed at times of public health disaster. So as you can imagine, with the last year and a half or so with everything with COVID-19, we have been out a lot. And so we do our day jobs, whatever we are doing for that agency, but we also can get pulled to whatever the public health need may be. We also do a lot of work with hurricanes when you need some of those initial response and individuals that might be displaced from their home and need medicine or supplies, or maybe have a few acute needs that may not be met in kind of the general facility shelter. So joining the public health service basically allowed me to do what I had been doing at ODPHP, but kind of this expanded other piece where I get to be deployed and do some on the ground work and kind of have some direct interactions and supporting individuals depending on what the need may be. Giving a little bit more background about my office, most people tend to know the products that come out of ODPHP versus our office itself. We're fairly small, but we sit in the US Department of Health and Human Services, so HHS, which is a pretty broad categorization, includes the NIH, the FDA, the CDC. If you start drilling down, it also includes the Office of the Secretary, and then down again, we get to ODPHP. Our office does a lot of work on the coordination side. So we lead the development of Healthy People 2030. So major public health initiative to set physical activity targets are part of it, but broad public health targets for our nation. The part of the work that I've been specifically involved with, I'm currently the acting division director for the Division of Prevention Science. And our division, along with USDA, leads the development of the dietary guidelines for Americans. So that's how I get to touch the nutrition piece. And then we also lead the physical activity guidelines for Americans. And so there's moments where I've taken a step back and said, wow, it is expensive to live in DC. It's busy. There's a lot going on. But then I look at some of the work that I get to do, and the policy that I have written over the last 10 years has literally touched and shaped in some capacity the lives of all Americans. And so I have been able to really find this interesting niche where I can take my research and clinical background and think about how that translates from a scientific perspective into policy broadly that's going to support the health of all Americans. And then on the other side, taking the policy and thinking about how do we translate that from a policy document to the consumer level. So we developed the Move Your Way communications campaign, which came out with the launch of the physical activity guidelines in 2018. And that was a way to kind of take the pieces of the guidelines and break them into manageable pieces, tips, tools, resources, fact sheets to help encourage more Americans to get the physical activity they need. So where I sit has given me a great opportunity to kind of see the landscape and also collaborate with a lot of other offices across the US Department of Health and Human Services, so CDC for a lot. So Anne's office, many of those individuals our office works closely with, as well as NIH, the Office of the President's Council on Sports, Fitness, and Nutrition, also merged in with ODPHP 2 years ago. So it's been a fascinating opportunity to see how we take the science, how that's shaped into policy, looking at it and tracking the surveillance that CDC is doing, how that feeds into Healthy People, and then how do we put out consumer resources and campaigns like Move Your Way to really help try to move that needle. Happy to answer any questions.
Thank you, Katrina. So I've seen a couple things come across just saying somebody said they never heard of the U.S. Public Health Service. So thank you for the additional information. That's a pretty common comment, actually, that I hear quite a bit. Somebody else said Public Health Service is amazing.
And you probably have seen us. Our uniform looks very similar to the Navy. So if you're in the DC area or in the Atlanta area, you probably have seen officers that may look like the Navy, but are actually in the Public Health Service.
Yeah. I don't see any more questions for you specifically. For folks that are on the call, feel free to look in the chat. There are people who have been answering some of the questions too. So I'm going to just open it up to questions for anybody just to kind of go through here. So I'm going to go back to Anne first. Let's see here. What's a good question for you? I got something to choose from here. What is the current focus or priority of the CDC, DNPAO, PAHB for the physical activity research and its sustainability of opportunities for physical activity?
Yeah, great question. Really the two areas that we're prioritizing and we're actually in process of putting together sort of a strategic plan and the action plan for these areas is really human movement and policy surveillance. For those of you who probably might have noticed this during COVID, it sort of underlined some of what we already knew, which was, that we really needed to look and see about some different data sources to track human movement in more real time. And there was some of that done by the private sector during COVID, which was a great example of perhaps us trying to look at some additional data sources outside of the usual public health data sources to try to understand human movement so that we can better measure physical activity rate. So that's a major priority. And then the policy surveillance really gets to a lot of the things that Suzanne was talking about in terms of what's going on at the community level and the changes in the community level, because we know if certain things, change in the community, that is going to increase rates of physical activity. That's what the science and the community guide recommendations tell us. So those are the two areas. And then, in developing this plan, it is with a focus on sustainability. We're a very small program, so really we have to look for opportunities to spread and scale with partners and others. So sustainability is obviously an important component.
Thank you. And then next I'll go to Suzanne. Somebody asked, what is one thing you learned by CrossSector Partnership that practitioners should take note of?
Yeah, I saw that question and I really appreciate it. And I'll say that the number one thing I think I have learned and I try to really honor is that a planner once said to me, don't tell us how to solve the problem, but tell us what your vision is for kind of the solution and let us help solve that problem. So, I feel like really my goal often is to go to partners and talk with them about, I would really like to see more people walking downtown. How can we make that happen? And really rely on other people's expertise. I don't really know how to, the planners know how to. As somebody noted, the people living with disabilities have a phrase that they use saying nothing about us without us. So really going to the population that you're wanting help with, or that you're wanting to see use these amenities, or you're wanting to just see out there and included, and get their expertise on what the solution is and how to get there. And be flexible. I mean, maybe your goal is not the same as their goal, and maybe there's some room for compromising, but still working in a way that will help increase physical activity for a population. So I think really not going in there with all the answers, going in there with not presenting a problem so much, but as a partner who wants to come together to find solutions and be open to creativity and being flexible and honoring other people's expertise.
Thank you. I'm going to call this a question for everybody, for all three of you. So somebody says they work at a large local public health agency doing epidemiology planning work. They currently don't have a physical activity program because funding is limited. That's the story of our lives, right? In physical activity. They struggle with identifying metrics to measure physical activity on the community level, knowing that the self-reported data for this topic can be unreliable. Without good metrics, is it hard to convince our stakeholders that this should be an area of focus? Any recommendations? Good question.
I'll go first. I'd suggest looking at some of the Healthy People data. So we're still getting all of it up on the website, but Healthy People 2030 and the previous 2020 and other editions do track meeting the physical activity guidelines. And so we do have data that does drill down, and you can look at it by population and do different filters on it and kind of manipulate the data. So if you're trying to argue for funding and make the case, I'd suggest also looking at your population that you're dealing with and looking at the rates of type 2 diabetes, hypertension, cardiovascular disease, and then compare that looking at the physical activity, who's meeting the guidelines, or look at the number of people that are physically inactive. Because there's some great linkages that we already know about the benefits of physical activity and what that can mean for some of these health outcomes. Also in the landscape of COVID, we're seeing a lot more data about physical activity and COVID outcomes in terms of disease severity and hospitalizations. There's a couple big studies that have come out recently from Kaiser and out of Korea as well. So there's a lot in there. The other piece I suggest too is looking in the physical activity guidelines, because that is all of the science of physical activity and various health outcomes. And so depending on where rates of different chronic diseases are within your community, that might help make the case, because there's all of the science underpinning of why physical activity helps type 2 diabetes, for example. But I would always start with kind of the science and what we have, and all of the federal resources that I've just mentioned are available online. They're free to share and use. Any of the infographics, the images, the data pieces, even going back to the Physical Activity Guidelines Advisory Committee report. If you want to deep dive 800 pages of science, but we have everything cataloged and all the pieces there, might give you a good starting point to make your case.
Yeah, this is Anne. If I could add to what Katrina said, which was absolutely the case, there is information out there. I think, you know, we actually have some state data that we track. It's called through our data trends and maps. You can just Google it and you could pull that up. So we do have some state level data, but we do hear from stakeholders the need for community level data by down to zip code. You know, this is some of the data modernization work that's actually going on, not just in our division, but across CDC, to try to provide more of that real-time data. And that kind of relates back to what I was talking about in terms of human movement. So there is some work that we're doing to try to be able to provide that and figure out a way that we could do it in an effective way that would assist communities understanding what's going on in their communities. We're a ways away from that. But to go back to your, so I want to make that point, but the other point I wanted to make is that there are, I don't think that not having data is always a barrier. I think having data can help target and focus some of the work, but there's a lot of momentum, and we've got some great fact sheets on this around some of these built environment community work that we're doing to improve the built environment in communities for all kinds of other reasons other than physical activity, one of them being for economic reasons. And so there's a whole host of other sectors who were very interested in this work for a variety of other reasons, many of them economic. So we're not necessarily finding that it's a barrier to spread and scale of a lot of these interventions. We seem to have hit a point of momentum where you know, you can kind of see the acceleration. But again, we always want to continue to improve our data. So hopefully that answered the question.
Yeah, and I just want to add one more piece to that, because I agree with what everybody has said so far, because the person who wrote in mentioned physical activity does not seem as important as things like food insecurity and housing, so it's not prioritized. I would say that those issues are connected to transportation issues, and transportation is related to things like first and last mile improvement. So people need to be able to walk or bike. They need good public transit, and all those things help support kind of that everyday physical activity. If people can't get to food or can't get from housing to jobs, then that's a problem. And one way to be able to support that is by making sure that people have, that all modes of transportation are available. So I think that there are ways to spin it so that physical activity does have a place. One big topic in Vermont, you know, and in certain states are things around climate change and energy use, and again, and electrifying the vehicles. And so another option, again, is public transit and active transportation modes, and making sure those are included in some of those other plans when talking about these other issues.
Thank you. We'll do one more quick question before we have our closing for all of you. This is a good question. If someone is interested in pursuing a job in physical activity and public health, where do you recommend they look for job opportunities?
If you're looking from a government perspective, I know us and CDC use the ORISE mechanism, and that's a fellowship opportunity that can get people in a little bit faster than going through the traditional USA jobs. It sometimes can land into something permanent. I actually started as a fellow in our office, and then there was an open position, so I was able to convert into a federal position and then join the public health service. But I would check out the ORISE announcements. I know for our office, we send announcements through our listservs and share that information. And then of course there's USA Jobs if you're looking for something government position, but just know that is a process.
Right. The other thing I would mention, in addition to what Katrina said, and absolutely, those are good. Those are places that we definitely look for resources. There are some public health informatics fellowship programs that are run out of CDC, which we are increasingly accessing for some of our work in our division, including for physical activity. So I would definitely check those out, and that's part of data modernization. So for those of you who are interested in data, and actually I think there's some additional resources that have been provided to another part of CDC to really strengthen the public health workforce, which could include some of this work. So I would definitely, you can get that information off the CDC website, hopefully, but, or again, reach out to me if you have any questions. But I think that's another option to keep in mind. And then obviously we fund communities out of our division. We fund communities, we fund state health departments, we fund cooperative extension to help us with some of our strategies, including public health. And so they obviously hire people to work on our cooperative agreements. These are grants. So there's also opportunities, I think, at the state and local level.
Yeah, and I agree with all those. And just keep in mind that, we talked about there are many different ways to get to a job in physical activity and public health. And so maybe if you can get something in a health department that might be a little bit off that direct mark, you might end up doing work with your physical activity or chronic disease programs. There might be other opportunities. So don't just shut the door if it's like a climate change position or injury prevention. Like a lot of those programs work with physical activity. So just kind of keep your mind open to what the broadness of a position and what opportunities that could lead to.
Yeah, and Suzanne, if I could add to that, that's a great point. And I think CDC is a very large agency. And if you can get into the agency as a full-time employee, then you do have opportunities to move around within the agency. So definitely if you have the opportunity to get a position, you might want to keep that in mind.
Great, thank you. So now with our closing here, I'm going to give each speaker 1 minute to give us their advice. If you have advice for students, early career professionals in the physical activity world, what would it be? So we'll go to Ann first.
Okay, great. So I have to start with something that I probably should have mentioned earlier. My first piece of advice is please join our national movement called Active People, Healthy Nation. This is to get 27 million Americans more physically active by 2027. It's a great movement. Just Google it, and the link is in the chat. But you can actually join as a supporter. Please join our movement to help promote physical activity. So that's one piece of advice. You'll also get connected with a network of folks, which was going to be my other comment, which is, expand your network, ask questions, use LinkedIn to access, professionals and others in the physical activity world. And don't be afraid to ask questions for folks about how they moved into their careers. I think the other thing that I will say, and this is something I think I've learned over the course of my career, is, follow your interests and what makes you, what feeds your soul, or just what you're interested in. And your interests will evolve over time and new opportunities will present themselves. So I think being very open, and it sort of relates to what Suzanne was saying about sort of being open to your maybe ideal position may or may not be available immediately, but there might be a related interest that you could follow, and you don't quite know where that's all going to land. And again, there's so much variety in potential opportunities to support and work in physical activity. So definitely keep that in mind. And I think just the final thing is, I think physical activity and public health benefits in general from having a diverse set of folks working in the field from a variety of backgrounds. So I think, if that interests you, then I think you can kind of expand your thinking even, beyond kind of the regular folks who work in public health. And I think we've given you some examples today of some different sectors that really could benefit from folks interested in public health. So hopefully, Alan, I kept within my minute.
Good.
Or close.
Close, good enough. We'll take it. Suzanne?
Yeah, I mean, I feel like I don't have a whole lot more, anything different to add other than just keep in mind that people get to different places in many different ways. So it could be through direct education, it could be through experience, through partnerships. I think keeping an open mind, being a good partner, I would say, really kind of showing up at coalition meetings or work meetings that you're not really sure if it's going to be directly related, but, just making those connections, showing up, participating in different opportunities. I think, like Anne said, just really talking to people who do this work, and keep in mind, there's so many different ways to do it, right? I mean, you could do things around data and epidemiology, you could do direct education, you can do a more policy position, that the field is wide. And you could do it from a engineering perspective, transportation. We have people in the Agency of Transportation that do bike ped work, so that you wouldn't think of them maybe as public health professionals, they're transportation people. So just keep in mind that there's, the field is really broad, and keep an open mind, talk to people, explore it, and just look for opportunities to make those connections and try different things out.
Thanks, Suzanne. And Katrina.
Well, I'll kind of echo a little bit what Anne and Suzanne had shared, but give a little bit of a specific piece too. I think some of the best money I've spent over the years is buying people a cup of coffee and asking to chat with them. As I was kind of navigating my path, and especially when I went to my undergraduate advisor and he said, I don't know what exercise physiology is. I was then determined to figure it out. And that meant forming networks and reaching out to people and saying, do you have time to speak with me? Can I meet you at Starbucks? Can I buy you a cup of coffee? Can I learn about what you've done? Can I do an unpaid internship? Can I try this out? I spent many summers doing different things, working in labs, working in cardiac rehab, just because I asked, can I try this? Can I learn about it? And sometimes I finished and said, nope, not for me. But that was some of the most valuable time that I had spent, because I was like, oh, gowned and gloved and pipetting all day, not me. I want to talk to people and I want to engage more. And so my advice is to, as you're navigating things, is to ask lots of questions, find people that will share kind of their path so you can think about how that might impact yours, and try things out. I think that seems to be a theme for all of this, is that there's many different paths to end up here. I still remember my graduate advisor when I said, I'm not going the typical academic path to go get a postdoc and be an assistant professor. And he was like, you're not gonna make it. Like, what are you gonna go do? And then I remember calling him and I'm like, I just published with all the people that are in the top of the academic world, and I didn't go your academic path. Like, I found this other path and I'm still here and still working with all of these people that you wanted me to be in this direction. And so I changed his mind. But I think there's lots of different ways you can get here. And I think the physical activity world continues to expand as we're pulling in these other sectors with transportation and the economic pieces. And so even if you're not direct physical activity, there's ways to put it in and connect those dots. So best of luck.
Great. Well, thank you. This concludes our webinar for today. So the webinar was recorded and can be found later this week on the Physical Activity Alliance YouTube channel and on the PA website. So thank you, of course, to the presenters as well as the attendees, and everybody have a great remainder of your week. Thank you all.